The purpose of this analysis is to compare health status and health conditions with social determinants of health by examining the rates of frequent mental distress given the rate of poor or fair health, the rate of excessive drinking, the rate of children in poverty, and the average county population size. The two geographical maps in our dashboard display the percentage of adults who reported greater than or equal to 14 days in response to the question. Now, thinking about your mental health, which includes stress, depression, and problems with emotions, for how many days during the past 30 days was your mental health not good? The data in these graphs are aggregated at the state and county level. Hovering over the state map will display a sentence interpreting the findings at the state level. Hovering over the county map will display a sentence interpreting the findings at the county level. The scatter plots at the bottom of the dashboard display the relationship between the rate of frequent mental distress and other important health and environment-related variables. First, the percentage of adults aged 18 years and older who reported fair or poor overall health. The percentage of adults that report either binge drinking, defined as consuming more than 4 for women or 5 for men, alcoholic beverages on a single occasion in the past 30 days, or heavy drinking, defined as drinking more than 1 for women or 2 for men, drinks per day on average. The percentage of children under age 18 living in poverty. Poverty status is defined by family. Either everyone in the family is in poverty or no one in the family is in poverty. The total number of individuals residing in the county. Using this dashboard, we can filter data to a range of population size of interest. For this example, we evaluate two subsets of data. The percentage limit the scope of our data to county population size of 13,367, which is the lowest in our data, and 20,000. Now, while the state level appears to limit the data to the states of Montana, North Dakota, and South Dakota, this is because when we present the average of all of the counties within a given state, the overall average is greater than the parameter we have set of 20,000. Of the 3 remaining states, North Dakota appears to have the lowest rate of frequent mental distress at 10.1%. Meanwhile, when we evaluate the county map, we see that many areas remain for evaluation. All of these counties are represented in the scatter plots below. We have on our y-axis the frequency of mental distress as a percentage. Specifically, this is the percentage of adults who reported frequent mental distress, given the question, now thinking about your mental health, which includes stress, depression, and problems with emotions, for how many days during the past 30 days was your mental health not good? On the x-axis, we see that as the rate of poor or fair health increases, so does the rate of frequent mental distress. By hovering over the trend line, we see that this positive correlation appears to be significant. For our purposes, a p-value less than 0.05 implies that these findings are not due to chance, but are most likely a meaningful phenomenon observed in the population of study. Further, when we evaluate the r-squared value, we see that without considering other influential variables, the rate of poor or fair health accounts for approximately 73% of the variation in our outcome variable, frequent mental distress. Thus, when we evaluate the rate of physical health, we can gain a predicted estimate of mental health and vice versa. We also see that the number of residents in a county does not appear to be related to the frequency of mental distress in that county. The use of this dashboard can reveal trends in health outcomes specific to the frequency of mental distress related to poor or fair physical health, excessive drinking, and rate of poverty.